from newborns to seniors. Let's review about SDG 3.
Welcome to The Explainer. Today, we are tackling a huge question, one of the biggest on the planet, really. How do we build a world where every single person has a fair shot at living a healthy life? Well, it turns out there's a global plan for that, and we're going to break it all down.
But before we jump into any of the policies or the numbers, let's just start with this one core idea. It's super simple, but it's also incredibly profound. Without health, nothing else really works, right? A kid can't learn, an adult can't work, a whole community can't thrive. Health is the absolute bedrock of all human progress.
So how on earth does the world even begin to tackle an issue this big, this fundamental? Well, it all starts with a plan, a very, very specific one. And here it is. It's called Sustainable Development Goal 3, or SDG 3 for short. The best way to think about it is like a shared global blueprint. It's a promise, really. A promise that pretty much every country on Earth has made to build a healthier planet by the year 2030. Okay, so let's dive into this blueprint and see what it's actually trying to build. And it starts exactly where it should, with protecting the most vulnerable people among us. So a huge and urgent goal, which is known as Target 3.1, is all about drastically cutting the number of mothers who die during pregnancy or childbirth. And the target here is incredibly clear. Get the global average down below 70 deaths for every 100,000 births. And that focus on new life naturally extends to newborns and young kids. Target 3.2 is aimed at ending all preventable deaths for children under 5. And again, the goal is totally concrete. Create a world where the child mortality rate is no higher than 25 deaths for every 1,000 births. And this part of the plan also covers something that's absolutely crucial for individual well-being and, frankly, autonomy. And that's making sure that everyone everywhere has access to sexual and reproductive healthcare services. Everything from family planning to just vital health education.
Okay, so from there, the plan really broadens its scope to take on the biggest health threats that we all face, both the old ones and the new ones.
Now, what I find really interesting about this is how it neatly groups our biggest health battles into 3 main categories. You've got the infectious diseases that spread, the communicable ones. Then you have the chronic, non-communicable ones. And so importantly, you see mental health and substance abuse right there, finally getting the recognition it deserves as being central to global health. Now, Target 3.3, this is a direct assault on the major infectious diseases that have just plagued humanity for generations. The goal is nothing short of ending the epidemics of AIDS, TB, and malaria, while also fighting back against other threats like hepatitis. But the plan doesn't just look at old enemies. No, it squarely faces our modern challenges. It recognizes the rising threat from non-communicable lifestyle diseases like cancer and diabetes, but also deaths from things like road accidents and the absolutely devastating health impacts of pollution. So you've got all these different goals, right? From childbirth to car crashes, from malaria to mental health. I mean, how could we possibly achieve all of them? Well, it turns out the plan has a kind of master key, and it's called Universal Health Coverage, or UHC. Now, you could argue this is the single most important overarching target in all of SDG 3. The idea is so simple, yet so powerful. Your health should never, ever depend on how much money you have. So this is the really crucial part. UHC stands on 3 essential pillars. See, it's not just about having a clinic nearby. It's about that clinic providing quality care, having the affordable medicines you actually need, and this is the big one, making sure that a hospital bill doesn't push your entire family into poverty. And this whole idea is backed up by concrete, practical steps. Things like investing in research for new vaccines, training, and just as importantly, retaining more doctors and nurses, and building really strong systems to warn us about the next global health emergency before it's too late. Okay, so now for a bit of a reality check. The goals are crystal clear, but the challenges are absolutely immense. And, maybe most importantly, they are deeply, deeply unequal. And this just perfectly illustrates what's often called the inequality gap. While global health has improved, the brutal truth is that where a child is born can dramatically and tragically change their chance of just surviving to their 5th birthday. A child in sub-Saharan Africa still faces a much, much higher risk than a child born in Europe. And on top of that, so many countries are fighting a war on 2 fronts. They are battling what's known as a double burden. So they're still tackling those long-standing infectious diseases like malaria and HIV, while at the exact same time, they're facing this rapid rise in lifestyle diseases like heart disease and diabetes that are more common in wealthier nations. And all of this leaves us with the ultimate question, doesn't it? The core challenge of SDG 3. We have the blueprint, we know what we need to do, but do we have the collective will, the resources, to bridge these huge gaps and make good health a reality, not just for some of us, but for all of us?
Thanks for your time to learn, earn, and lead. This is Mohammad Zishan Awan, Advocate High Court. To join Vision 2047, please register with us and be part of the transformation.